Welcome to Virtual Course Development and Implementation, 15 years experience. It's our pleasure to welcome all of you to this amazing session led by Tobey Clark and Rossana Rivas from WHO Collaborating Center for HTM and Technical Services Partnership at the University of Vermont, US, and Paul D.R. Taylor, Ministry of Health, Trinidad and Tobago. Next, please. As we said, the team is based on Tobey Clark, co-director of WHO Collaborating Center for HTM and an engineering supervisor at Technical Services Partnership at the University of Vermont, UVM, USA. Rossana Rivas, myself, consultant of WHO Collaborating Center for HTM Technical Services Partnership at the University of Vermont, UVM, USA. And Paul D.R. Taylor, Biomedical Engineer Consultant, Project Management Unit at the Ministry of Health, Trinidad and Tobago. Next, please. Since 2006, and in that age, the beginning was done with the support from Biomedical Health Organization Foundation. This amazing project started. It was the partnership between the University of Vermont, Pontificia Universidad Católica del Perú, and Universidad CES from Colombia. Tobey Clark was the principal author. Myself, Rossana Rivas, with him coordinated efforts with the Pontificia Universidad Católica del Perú. You could imagine that through the years 2009 and then 2021, now with the excellent experience achieved with several countries. In the beginning, it was these two countries, but then it was expanded through the Latin American region and the Caribbean region. And now in 2021, we are not just providing, developing contents, but making inclusion of best lessons, best practices, and the trends now in the middle of the pandemic. Now, today, in this year, the course is being done in French and Portuguese, and the results are amazing. Currently, we are giving the course to Haiti. Every short courses of HTM have been taught by Clark and Rivas over the past 5 years in Latin America, and the mix was not just in public organizations like Ministry of Health or Social Security System, but also for private organizations and also non-profit organizations among several countries of the region. Next, please. And this is my last part. We can easily observe that one of the global health trends is the Leapfrog Approach. COVID-19 set diverse challenges, but one of them, of course, is the no opportunities to make travels or make presential activities. And these online courses turn to be not just an action or an intervention, but key component of the strategy. And this strategy is a Leapfrog one based in health technology planning and health technology management that contains the core of this online training. Technological planning, technology acquisition, and management of technology assets are based on the main trends of the participants among the number of countries we have been sharing with you is part of our experience of 15 years. And now I will be glad to say to my colleague, Taylor, Paul, to continue. The floor is yours, Paul.
Okay, thank you very much, Rossana. And Trinidad and Tobago has been a country that has benefited from this training. Just to give some background, Trinidad and Tobago is a twin island republic. All right, it's a democracy headed by a president as head of state and a prime minister and cabinet that runs the government. We have a population of 1.4 million people, and of course, we're the most southerly island in the Caribbean chain. Now, the origins of biomedical engineering in the country started in the early 80s. In the early 80s, the government set up a special purpose company called Hospital Maintenance Company, in which the focus of that company was to do repairs in medical equipment. At that time, there was a gradual evolving of technology in medical equipment, and the government recognized there was need to have specialized people to do that. The first group of engineers, or the first group of engineers joined in 1989, all right? And that by that time, the company had been taken out of service, and the individuals were all placed in a new organization called the Eric Williams Medical Sciences Complex. And so it is from there that the field really accelerated. It was a new facility, and there was significant amount of training from manufacturers all around the world. In 1994, there was a law passed that changed the way health care was to be delivered in Trinidad. It was the Regional Health Authority Act, and it basically divided the islands into 5 regions and created independent, autonomous organizations to run and deliver healthcare in those systems. So the Ministry of Health was removed from being a delivery agency and became a financing, sponsorship, and regulatory agency. Now, in those early days, again, when there was a purchase of equipment, the engineers and technicians within the field would be trained from the RHAs. But then in 2004, there was a policy change that represented a watershed moment for biomedical engineers. The policy change was that equipment purchased from manufacturers, significant pieces of equipment rather, purchased from manufacturers should come with extended warranties. And that meant there was a movement of training and technical competence and capacity building, moving from the public sector to the private sector, to the companies that provide. And so that created an absence of training opportunities for a number of years until it really became significant. It was a significant impact in the development of the biomedical engineers in the public system. And so in the absence of this, the opportunities for development came the virtual training offered through by PAHO and instrumentally administered by Professor Clark. And in that period of training, which started 2014, 2015, okay, there were a number of people trained, and there was a return to capacity building and strengthening the biomedical engineering field within the public sector. So many people, 24 persons, were trained in health technology planning and management courses. We had the introduction to biomedical technologies where 6 people were trained, and there was that infusion of knowledge and capacity building taking place that did not happen for more than a decade because of the policy change and the shift in which from which knowledge flowed out from the public sector into the private sector. Okay, so this is how we in Trinidad and Tobago benefited from the virtual training organized through Professor Clark and his team. And now I want to hand over to Professor Clark to continue.
Thank you, Paul and Rossana. So the goals of the project and the final users that will benefit, virtual education certainly has been very strong during the pandemic, and it's really an excellent way of for introductory biomedical technical training and clinical engineering training. There's so much resources on the web, the internet. There's documents, videos, simulations, all types of learning tools that are freely available on the internet. The new technology that has been developed, it benefits the students, the instructors, and engages students. So the interaction via the internet is very strong. Many times students that in a classroom won't ask questions will freely do so when it's done on the internet. As far as virtual reality is the next step in terms of virtual education. And this is particularly suited for simulated hands-on experiences such as maintenance. So the results of the course, continuous improvement in our university level courses. The methods that we educate have changed over the time since 2006. And again, it focuses both on the technical and the clinical engineering capacity building. So over 1,200 students have taken these courses on the PAHO Virtual Campus, University of Vermont, the PUCP University in Peru, and CES-HTMC in Colombia. The translation of the courses is going to be a very big help in terms of access, Spanish, French, and Portuguese. That has really added the value of the courses. Short courses, as Professor Rivas described, has involved both the public health sector, the Ministry of Health staff, the clinical biomedical engineers, biomedical engineering students, and pharmacy professionals. So the use of these new technologies for virtual learning has resulted in more engagement, improved learning, and higher approval ratings. Thank you.